Hello, and welcome to the DeSera Clinical Education Infectious Disease Podcast. I'm your host, Jennifer Blanchette. Today's episode is one component of a larger program on transcending barriers, transforming outcomes, hearing and meeting the needs of transgender people living with HIV. Transgender people continue to be the target of discrimination and marginalization across the globe. They also bear a disproportionate burden of HIV and face more substantial barriers to accessing HIV care, including higher rates of homelessness or housing instability, mental health challenges, and substance use. These disparities are even greater for transgender people who are also part of racial and ethnic minority populations. Healthcare professionals can play an important role in improving HIV care access and delivery for transgender people in a variety of ways, including by being aware of the wider healthcare needs and priorities of this group and understanding how HIV fits in among those needs. For this episode, I spoke with transgender people living with HIV or advocating for those with HIV in the United States, Europe, and Asia. And I asked for their insights on healthcare priorities, HIV, and how services can be made more accessible and welcoming to the transgender community. For more information on our faculty and for a link to the overall educational program, please visit the show notes for this episode. When it comes to overall healthcare needs, everyone I spoke with felt that affirmation of their gender identity is a top priority. Tori Burke, a transgender woman who serves as an advocate for transgender people living with HIV, shared her perspectives from the United States.
So I think for trans individuals or trans folks or people who identify as trans or non-binary, I think they want to go into a space and be affirmed as who they deem themselves to be in that space. That's the most important goal when they're walking into a clinic or a setting. How do you recognize me? The person on the other side of that, how do they affirm me? Even if I'm going in and my license say he, how do you recognize me as she? And I think that's that piece where trans individuals want that to be kind of like non-thought of. They want to go into these clinics and these spaces and just know, hey, you're looking at me, you're recognizing me as she, you're affirming me as she. So I think we got to put that before anything, just being able to go into a space and just being recognized as how you mentally identify.
Erica Castellanos, who lives in the Netherlands, shared similar sentiments, and she also pointed out that access to gender-affirming HIV care is tied to other human rights within society.
I think some of the overarching health priorities and well-being for trans people are particularly access to gender-affirming care when that is needed. I also think overall health conditions, including HIV, is a high priority for trans people, particularly in countries where trans people have a high percentage of persons living with HIV or acquiring HIV. So we have countries where trans people prevalence rates are up to 50%. I think in those settings, issues of HIV care prevention are super important and are a high priority. But it's interconnected other issues. For example, access in general, which comes with gender identity. And this trickles down to the other access rights and well-being of trans people. For example, opening a bank account, being able to own a house, being able to register for service with a healthcare provider, ensuring that you are referred to as the person you identify and are not dead name or use inadequate pronouns, for example. So it's all interconnected and linked.
To better understand the critical role of gender affirmation in HIV and other healthcare for transgender individuals, it's important to consider the day-to-day struggle of living as a member of a highly marginalized population in which that marginalization is specifically based on gender identity. Here's Erica again.
Everyday life, a lot of trans people undergo very difficult circumstances. In many parts of the world, our communities are criminalized. access to health services that we have enjoyed in the places where it is possible, because it's not possible everywhere, is being rolled back. Stigma and discrimination is on the rise, and it's very difficult to feel safe in any part of the world at the current moment. Trans identities are being used as political pawns in politics in the US, in Europe, in Africa. In fact, there's no region in the world where this is not happening. It is fueled by anti gender rhetoric and organizing, which is very visible, the negative results for trans people. Very direct, visible results, trying to dismantle access to care, trying to take away the right of existence of a human being, dehumanizing trans people.
Tanya Legging also shared her perspectives on this from the Philippines.
Transgender and gender diverse individual in the Philippines, actually not only in the Philippines, but in a general spectrum, we still continue to face, unique challenges in accessing and maintaining HIV care. It's include medical and social and even psychological issues. The top issues will be the fear of stigma and discrimination. Many transgender people fear being judged, misgendered, and even treated unfairly in a healthcare settings. In a small health center, and even in the biggest hospital, they experience all those issues. So the fear often discourage them to seek testing and even continuing in treatment.
Aria Lester, who lives in the United States, described a similar struggle.
And when you're looking at a life where it's even difficult for you to find a job, outside of something that is specifically trans oriented, there's a lack of insurance. There's definitely a lack of access to mental care. And so all of these factors all just come together to really make the plight of a trans person, even more specifically a Black trans woman, it makes it just difficult just to live everyday life.
As Aria mentioned, for transgender individuals who are members of racial or ethnic minorities, discrimination is more deeply layered, often termed intersectional. Aria elaborated further on this.
I use the example of, being 3 blocks away from a person. At that 3 blocks, they can visibly see that I'm Black, right? And so any hate and discrimination that they have towards Black people come up on that third block. When I'm on that second block, you then see identifying factors of my gender expression, and you see that I'm women presenting, and so any bias or misogyny that a person has comes up from that. And then, on the first block, we may have a conversation or interaction with something that kind of makes your brain clue that I'm trans, and that's a whole other level of discrimination. And so for Black trans women or Black women with trans experience, you're looking at kind of a threefold societal discrimination against one individual. It's not an easy path to take. And from all the challenges that have been stated, we have to realize that we're still just a human experiencing life for the first time, and to have to push through hate and discrimination when you're on the bus, when you're walking down the street, when you're just going to the store to pick up something for your house, and you kind of expect that it's going to be something. It's going to be a look of disgust. It's going to be, some hateful statement that someone says, or, even at the other end, there could be violence.
It's clear from these insights that gender affirmation provides an essential message of safety. And on the flip side, misidentifying the gender identity of a transgender person or providing services that ignore the need for gender affirmation could signal the potential risk of danger. The effects of a non-gender affirming environment are profound and can result in the inability to access care at all. Tori described her experience seeking hormone therapy services in non-inclusive healthcare settings in the United States when she was younger.
Oftentimes I would go in there, and I was younger at this time, so I didn't have a gender marker change. I didn't have a name change at this time. And I would go in these spaces and they'd be like, he, and I never forget. I was in a space and they did that. It was so demeaning that I left that space and I never went back to a clinic again to get any type of care.
Recognizing the unique reasons transgender people may not engage with or may be lost from HIV care is just the first step to being able to work toward overcoming care access barriers. The next step is learning about practical strategies that healthcare professionals can take to configure their HIV services in ways that help overcome those barriers and better meet the needs of this key population. In other words, what can you do in your practice? One element that constitutes the foundation for all aspects of improving HIV care and overall health care for transgender individuals is healthcare provider education. Here's Aria.
To be welcoming to transgender people is a few things that have to be layered. The first and foremost thing I would say is education. Educate yourself on being respectable to trans individuals. It's kind of, I giggle because it's crazy to say we need to learn to respect each other as humans, because you would think that that would be the base thing that we would do. However, we're not in that reality. We're in the reality where people have to learn how to respect other individuals and other cultures and other identities. And so from the, not even a front desk person, from the security before you walked into the building, to the front desk receptionist, to the nurses and the physicians assistant and the doctor, all need to have at least a base level knowledge of how to respect the trans individual.
Aria also noted the importance of the physical environment within the clinic.
Another thing could be, utilizing things like trans flags within the office, having a specific trans healthcare program, with providers that are not only educated but versed and knowledgeable when it comes to treating trans individuals, and being open to learning. Sometimes as trans people, we have to educate our providers, unfortunately.
Tanya shared additional thoughts on the importance of messaging and visible information when creating a welcoming and inclusive healthcare environment.
Creating a safe space is a fundamental step to reduce stigma and discrimination for all trans individuals. Foster an inclusive and affirming environment. Let's continue to use correct names and pronoun consistently. Let's display inclusive symbol much better if we have a materials or even we have a pride flag in our healthcare clinic.
Although a welcoming environment needs to include clear messaging and displays that signal safety and inclusivity, it should go beyond that by also promoting accessibility for the transgender community. Here's Erica.
I feel many times we fail to deeply describe what ideal healthcare provider or healthcare access process can be about, and we mainly touch superficially what that means, and we use phrases like trans-friendly healthcare settings or trans-friendly healthcare provider. And I know what everybody means by saying that word, but I can care less if my healthcare provider is my friend or not. What I need is a place, an environment, and a healthcare provider that has the tools and that has the qualification and is professional to provide me with the services I need. In countries where there are legal barriers at the state or national level for accessing restrooms, for example, having gender neutral or inclusive restrooms is safe. It makes you feel welcome, it makes you feel seen, it makes you feel that you will not feel nervous and that the healthcare center is aware of the barriers and is facilitating that you can be engaged and feel safe.
Confidentiality is another critically important aspect of providing care that feels safe for transgender people, as Tanya explains here.
So we should embrace that confidentiality remain a major core concern. Transgender individuals, especially for living with HIV, often fear that their identity or status might be disclosed without their consent. So we healthcare facilities or healthcare providers should implement the strict privacy policy for this.
A major issue that creates obstacles and excess burden for transgender individuals is the persistence of binary gender classification. Here's Erica.
Also, making sure that intake forms are welcoming and are not set in a binary way. And that the health system, the health information systems in general, are reformed in such a way that, again, they're not binary.
Although changing this globally will require the concerted effort of many individuals beyond just healthcare to enact system-level shifts, healthcare professionals can serve as advocates for change, particularly when they understand how it complicates care and impacts transgender health. They can also make changes within their clinical settings, as Erica noted, which can help to set the stage and inform broader measures.
I live in the Netherlands now, and I've changed my gender identity, my legal documents. A good thing is that automatically hospitals, banks, everyone knew about this. And my gender just switched in all information systems. The bad thing is that there are specific services for people who have a womb, a uterus, that I do not have, that I get constant reminders that I have failed to go my uterine exam. So the system is so binary that once it goes female, it doesn't recognize that there's this new set. So we have married in health information systems our charts or our flow charts of services to specific binary system. I think that needs a huge reform in the current world that we are living. And it doesn't take into consideration also other identities or other issues, like, for example, intersex people.
Another step that clinical settings can take is to aim for diverse staffing that includes transgender individuals when possible. As Erica explains, representation matters, and it can go a long way toward an overall better informed staff.
I always find it welcoming when I go to a healthcare setting and I am greeted by another person like me. It's not a must, but it feels so good. It's like it brings a smile to me. It makes me feel, oh my God, I don't need to explain in detail everything. This person knows what I'm talking about. Because many times we find ourselves explaining to our healthcare providers or getting questions that perhaps we should never get. Like, why did you decide? You know, there's no decision. This is who I am. So I think it helps a lot in the process.
When considering the broader healthcare needs of transgender individuals, as well as the issues outlined earlier in this episode related to stigma and discrimination, there's one strategy that may be most powerful. It can reduce the burden of HIV care while also showing a commitment to prioritizing the full range of care needs. And that strategy is integrating care to the greatest extent possible. For example, providing gender-affirming care as well as mental health services and routine care alongside HIV treatment. In the general population, integrated care reduces barriers in several ways, including by improving convenience. But for transgender individuals, it goes beyond convenience because it also reduces the risk of discrimination. Aria explains here.
The more locations that you have to go to in order to get the care that you personally need, the more chances it is that at least a couple of those places are not going to be welcoming the trans individuals, wholly and fully when it comes to, everyone being educated, everyone being knowledgeable, and everyone being respectful. And, a lot of trans people go to community-based organizations that offer some medical services, be it through a partnership with, a doctor or a mental health provider that comes to the site to service individuals, or, even having their own clinics, at the community-based organization. They still may need to be referred for other things. And, that referral may be something that kind of closes off whatever that portion is. If you, aren't able to get your dental care, at a community-based organization, but the dental care that is available is not welcoming to you, then you're going to neglect getting your teeth, regularly serviced. And then that's going to affect your dental health. And so it just kind of layers on. The more fragmented that the services are, the more likely it is that that person is going to have a bad experience that then it's going to make the care or whatever that piece is be neglected.
Erica agreed with the importance of integrated services, with gender-affirming care at the top of the list.
When we talk about the care that trans individuals need and what should be integrated, of course, to many of us, including gender affirming services, is going to be on the top of the list. Noting that not every trans person wants hormone therapy. Not every trans youth wants puberty blockers. Not every trans individual wants gender affirming surgeries. So, with this in mind, having options is key. But I think apart from gender affirming services, importantly also is the routine screenings, routine care, and management of existing conditions.
Given the challenging life circumstances experienced by many transgender individuals, mental health services should also be integrated whenever feasible, or at the very least provided through strong referral networks, ideally with warm handoffs. Tanya highlighted these overarching mental health needs.
The mental health and psychosocial support would be very important. Nowadays, we are starting to use the psychosocial first aid for all the, not only for trans clients, but especially for them, because we believe this is a vital aspect of transgender well-being. This is also addressing the stigma and discrimination, even the internal stigma that they are facing.
Erica agreed with these sentiments.
I think mental health support is also extremely important. I think counseling, a lot of trans people have gone through a lot of trauma in their lives. Many of us were chasing away from our homes at an early age. We have been homeless. We have experienced migration, stigma, discrimination. Some of us have been put in jail because of who we are. So, support programs to really address and really be able to address these traumatic events is important. And so trauma-informed therapy is a high priority. I'm not saying that every trans person goes through this, but a lot of trans people, when we share our life experiences, we see so much similarity around these issues, especially the challenges around youth.
In real-world settings, fully integrated services are often not feasible. Yet healthcare professionals can still reduce barriers by being aware of what services are likely to be needed and making sure that they have transgender welcoming and safe referral networks, as well as a willingness to obtain more information when needed.
I don't expect one healthcare provider to have all my questions at all. I don't expect them to know everything about HIV and trans healthcare and every other issue that exists in the world. But I do expect them to be open to talk to other healthcare providers, especially if it's two different healthcare providers that give me service, and to listen to me, to be open to listen to me and respect that voice. And I really do. I've had some experiences with my healthcare provider, my HIV healthcare provider, that she tells me, I don't know about this and how it will interact with your healthcare, with your gender affirming care. Can you give me a week? I will consult with colleagues and come back to you. I prefer that than going in the blind. And I know it also shows me my healthcare provider deeply cares about my service. And she's taking the time to consult with colleagues to then come up to a decision. That is no indication of lack of knowledge. That is indication of deep empathy and care for me. So I think that's what I would ask for.
If it's possible, when establishing referral networks, healthcare professionals can also consider additional needs based on social determinants of health that specifically affect the transgender community, such as legal and social support resources. Tanya shared the importance of collaborating with community support organizations.
The social determinants of health. This is very important. No? So let's continue to collaborate with any, even small organization in our community. I believe this is the biggest one step forward. Let's continue to work with them. Collaborative effort will do the biggest impact for the community and even the livelihood, the shelter, the education support, and even link them to psychosocial, to legal, and even in financial assistance programs.
Erica also underscored the importance of broader support services for transgender people.
And I think another thing that might not be fully linked is around, but it has to be seen as a whole, is legal and social support. So social support to be able to, have housing access, or legal support for gender affirming identity, gender identity recognition, for example, that just cascades into everything else. When I was living back in Belize, I couldn't change my gender. And I was often ending in a police station because when I would hand up my driver's license, the officer would say, "This is not you. The driver license says another gender. This is not you." So I would have to go to the station and provide a whole explanation. And unfortunately, in some cases, it goes all the way to have body searches and all these horrible scenarios. But it just trickles down to everyday life. Everywhere where you need to show an identity, be that in an airport, a hospital, a bank, everywhere, if your identity in your legal documents do not match what you represent, who you are, it becomes a problem because then you have to constantly be explaining to people. And because people have an entitlement to their own opinion, they're not always in agreement with those things.
We started this episode by considering the healthcare priorities of transgender individuals living with HIV. We heard that gender-affirming care is often the most important healthcare need for this group, regardless of HIV status. For the HIV care provider, it can sometimes be difficult to square this with their own primary mission, which is to deliver life-saving HIV treatment and help their patients achieve undetectable virus levels. Yet, establishing and nurturing a relationship of trust with their transgender patients frequently requires that HIV be relegated to a lower rung within the overall health and non-health issues that are front and center for their patients. I asked Tori for her thoughts on how HIV care providers can navigate this challenge.
So, if I was speaking directly to health providers, one thing that I would say, understanding that transgender individuals, there's a good 80% probably of transgender individuals who are HRT is just as important to them as coming in for their HIV care. I've sat down in front of some medical providers, like I've went to appointments with clients before, and I've sat down with their providers. But the one thing that I noticed that sticks out to me is kind of they have these conversations with clients, but they oftentimes negate the fact that the clients are looking for their HRT treatment in the process of also doing their HIV care. And oftentimes I've heard certain medical providers say, well, you shouldn't be worried about HRT right now. Let's just get you healthy right now. I think, and I understand the importance of that, but I think that there's a way to have that conversation and not negate it or make that person feel like what they're bringing to you is not important. Because what oftentimes happen is when they skip over clients like that, clients then, when they are having other ailments or other issues going on, they won't discuss it with the provider because the provider has not provided a safe and inclusive environment for them to have that conversation. And so I would say to them, even if the person should not be getting a particular dosage of HRT medication, or you don't think they should be having any medication right now, have real conversations with these clients. Hear them. A lot of times, oftentimes, clients just want to be heard. Sit down and actually hear them out, and understand why they want this. Because it's not just physically, it's psychologically, it's mentally. They want this because this is the thing that kind of keeps them sane. So, my grants to providers will be sit down, have these conversations with clients, understand their needs, and how we can work together, the providers, the clients, and even me as the person that comes in as a coordinator on behalf of the clients. How can we work together to make sure that everybody in the process is getting something that they need and we're all feeling inclusive in the process? Because ultimately, it is the client's care, and we do have to understand that we have to respect people's wishes sometimes. And sometimes that just does not always align with what the provider thinks they should have.
Well said. Let's close by hearing final thoughts from Erica and Tanya. Erica summarized the need for holistic, person-centered care this way.
For a trans person to enjoy the highest attainable well-being, we need to see trans people like with other individuals from a holistic approach to healthcare provision, where we don't treat diseases, but we answer to the needs of the person.
Finally, Tanya shared her thoughts on the power of healthcare professionals to be a transformative force in the lives of transgender people living with HIV.
Healthcare providers hold the power to transform systems that have long excluded and marginalized people like transgender individuals. So every aspect of care, policies, practices, education, and advocacy, these are all important. And these will help us to address the deep-rooted impact of stigma and discrimination. So the human rights, social justice, and compassion is there.
I would like to extend warm thanks to Aria, Erica, Tanya, and Tori for taking the time to talk with me and share their perspectives from the United States, Europe, and Asia. And many thanks to our listeners for joining us. To learn more from our educational program, click on the link in the show notes. And to get access to all of our new podcasts, subscribe to the DSERA Infectious Disease Podcast on your favorite player. Thank you, and see you on the next podcast soon.